For our next presentation, we have Alexandra Gross, who is a writer and researcher with a Bachelor of Arts in Sociology from Mount Royal University in Calgary. She is currently pursuing a master's in social policy at the University of Bath in England. Her primary areas of interest include education, social inequality, and history. Here she is with her look at caregiving for disabled dependents before, during, and after COVID-19, a critique of pandemic privilege.
So, as Alyssa said, I'll be talking about the informal caregiving of dependents with a disability in the context of COVID. So, the research comes from a book I wrote with Gina and Alicia, who are both doing presentations today. And in this book, we covered caregiving for children, the elderly, and individuals with disabilities. So, it's this third section that I'll be covering in this presentation. So to start, I think it's important to take a few seconds to just define what the term disability means, especially in the context of this study. So as you can see here, Statistics Canada uses a wide variety of categories when defining a disability. A person's self-reporting can identify multiple disabilities, and there's a lot of variation in terms of severity as well. The focus of this study was to identify patterns in the experiences of all caregivers providing informal care to individuals with all types of disabilities, so the scope is quite broad. So keeping this broad definition in mind, we see that in 2017, 22.3% of the population self-reported having a disability, and this percentage is up quite a bit from 2001, when 14.6% self-reported a disability. So this increase is due to several factors, including improved quality of life due to improvements in medical care and technology, leading to longer lifespan. We also see that the likelihood of having a disability is dependent on a few different social factors. So logically, the likelihood of having a disability increases with age, and these individuals are also more likely to be economically disadvantaged. Disability is also gendered, with women more likely than men to have and develop a disability, as well as being more likely to have a more severe disability. So now I'm just going to briefly go over who the informal caregivers are. So we know that about 8.2 million Canadians are providing informal care, which works out to be about 28% of the population. This number is also up from 1997, when under 3 million Canadians were providing care. And this increase is due to an ideological shift from formal institutionalized care to informal caregiving within the home. So while this change undoubtedly improves the lives of many dependents who would otherwise be cared for within hospitals and care centers, and also saves Canada's healthcare system up to $31 billion annually, it shifts a lot of the financial burden onto the informal caregivers, 41% of which spend between $100 and $300 per month out of pocket on care expenses for their dependent. We also know that informal caregiving, like disability, is very gendered, with more women than men providing care, and female caregivers putting in more hours each week than male caregivers. And then, of course, age is also a factor, with older caregivers spending more hours each week on caring than their younger counterparts. And we also know that most are providing care to a relative, with only about 13% providing care to someone who is not a relation, such as a friend or a neighbor. So from this point on, I'm going to discuss the caregiving experience before the pandemic, how it changed during the pandemic, and what the greatest challenges are likely to be post-pandemic. And I also want to note that although this research focuses on the challenges that caregivers face, many caregivers also report feelings of satisfaction and purpose through being able to provide care to their loved one. So there are lots of positives to the caregiving experience as well. So starting with before the pandemic, across most bodies of research, we see 5 main recurring themes. The research tends to show that the higher the complexity of a dependent's care needs, the worse the health outcomes are for the caregiver. So for example, someone providing care to an aging parent with dementia, mobility issues, and physical pain is likely to have poorer mental and physical health than someone caring for a dependent with just one of those care needs. High complexity of care often results in high levels of stress for the caregiver, which has physiological impacts as well, such as high blood pressure and a depressed immune system. One study actually found that caregivers were on significantly more medication than non-caregivers. And as mentioned briefly earlier, economic well-being is a struggle for many dependents and their carers, and many caregivers, especially those with young children, find it difficult to find a job that allows them the flexibility that they need to perform their caregiving role. Many worry about losing their job due to the flexibility they require from their employer. In addition to caregiving complexity and employment difficulties, caregiver stress can also arise from trying to manage competing demands. So, for example, a caregiver looking after an elderly parent with one or more disabilities, while also holding down a job and looking after their own children, may find it difficult to find balance. Despite these persistent sources of stress, study after study shows that these negative impacts can be mitigated or removed altogether through strong social support networks, and that caregivers who ascribe to cultural beliefs that emphasize community and family have much better health outcomes. Now, moving on to the caregiving experience during the pandemic, we'll look at pre-existing challenges that have been exacerbated, as well as unique challenges that haven't been encountered before. So one of the big societal changes was the move from working within a public workplace to working from home. Caregivers reacted to this adjustment differently depending on their unique situation. So parents with a child with a disability found it very difficult to juggle their work responsibilities and care responsibilities in addition to taking a big role in their child's schooling at the end of the last school year. Many also said that they really missed having a separation between their workplace outside of the home and their care work inside the home, as the balance between the two was really important for their mental health. However, on a more positive note, some found that the change made managing the responsibilities easier, as they now had the flexibility they needed to move between caring for their dependent and completing their work responsibilities without neglecting either. A new challenge resulted from the initial shutdown of programming that was deemed non-essential. Many non-life-threatening medical treatments, as well as programming that facilitated socialization, were suspended, which resulted in some dependents experiencing a regression in their symptoms, and subsequently caused increased work and anxiety in their caregivers. Physical distancing measures also resulted in a loss of social support. Caregivers with dependents who are health compromised and therefore at a greater risk of experiencing severe or even fatal COVID symptoms have had to essentially quarantine themselves. And this, of course, has made it impossible to get any outside help from family and friends. There was also a discourse going around, particularly at the beginning of the pandemic, that asked why a young and healthy individual should have to put their life on hold for the elderly and the health compromised. And this has obviously isolated carers and their dependents further by essentially rendering them as socially disposable. So understandably, this discourse has negative mental health impacts and caused many to feel more alone than ever. We've also seen the widening of the employment participation gender gap in Canada since the start of the pandemic. In January, there was an 8 percentage point difference between men and women participating in the labor force. And then in April, when the economy shut down, employment rates dropped significantly for both men and women, but the percentage point difference between them had grown to 9.2. Data for July indicates that although more men are working now than they were in January, women have not returned to the workforce at the same rates, and the percentage point difference between them is currently at 9.9. So it's continued to grow. And then this is really problematic because, as we discussed, women are doing the majority of the unpaid care work, and over half of the individuals with a disability are female. So the economic impacts of the pandemic are really felt by this demographic. So finally, based on research on the long-term social effects of past pandemics, I'm just going to go over the main challenges that are likely to arise for caregivers and their dependents post-pandemic. So the first big challenge will be dealing with the psychological impacts of the pandemic. So research shows that when a person's physical and social environments are disrupted permanently and abruptly, they experience long-lasting psychological impacts. They tend to feel a deep sense of loss for how the world was before, and they struggle to adjust to a new normal. Many studies have shown that quarantine periods of even just 2 weeks have negative mental health effects, including anxiety and depression, that last long after the quarantine period is over. So this is something that is going to affect everyone overall, but for caregivers and their dependents who depend even more on a stable environment and structure, and who may have been quarantining for months at this point, the mental health effects may be quite severe. Studies have also shown that the loss of social support networks causes long-lasting trauma. So the caregivers who depend on this will really feel the effects. Caregivers and their dependents also have a great financial need in addition to struggling to find suitable paid employment. And because they may not be able to return to work as soon as the rest of the population, the effects of this will be long-lasting. However, one positive aspect is that upon economic recovery, employers may be more willing to work with caregivers to provide a more flexible approach to employment, as businesses have had to be flexible throughout the pandemic, and innovative technologies have been developed to allow businesses to function outside of the office environment. So to finish, I just want to touch on some limitations of this research and make a couple of suggestions on where the focus needs to be to mitigate the unique challenges caregivers are faced with. So as I mentioned, disability is such a broad term, and this study was very general. So future research needs to be micro-focused. Researchers will need to look at the effects of the pandemic on specific types of carers and specific disabilities to identify where the cracks are for each demographic so that effective policies to fill these cracks can be developed. There also needs to be more financial assistance for caregivers and individuals with disabilities, and accessibility to mental health supports and resources needs to be improved. Individuals with a disability tax credit certificate and other disability-related beneficiaries will receive a one-time payment of $600, but this doesn't go very far. And finally, programs that target caregivers and their dependents also need to be increased to rebuild those networks and reverse symptom regression independence. So that's where I'll end things, and I'm happy to answer any questions to the best of my ability during the Q&A period. Thanks.
Thank you so much, Alexandra. Jess is asking, how do you suggest implementing some of the recommendations you made to relieve the repercussions of caregivers? Whose responsibility do you think it is to implement them?
I think that the government definitely has a role in funding and facilitating this. And the government actually did create what they called the COVID-19 Disability Advisory Group to address systemic gaps. So I think implementing something like this on a provincial and regional level and putting more focus on caregiver health in addition to the health of dependents would be really helpful. And then just increasing funding for mental health and counseling resources, because those can be quite expensive. So that would be really helpful as well.
Awesome, thank you. Okay, so for our next question, it's going to be for Alexandra. Zach is asking, you focused on informal caregiving. Is there a way that systematic caregiving can assist in the burdens, or would the system be wiser to focus on other ways of helping, such as the social programs and benefits for unpaid caregivers that you suggested?
So I think there are definitely more ways now to help in a more formal way. But at the beginning, when the healthcare system was overburdened, that support wasn't really available. So you could hire a formal caregiver to come into the home and help. But again, if the dependent is health compromised, that hired person is going to need to sort of quarantine with that household. And again, like I said with the last question, I think the mental health and counseling is really important. So I think that's where a lot of the emphasis needs to be.
Okay, great, thank you.